You're telling me a lot about the psychiatry of it, but we've been using ketamine for a long time before it was used for mental health.
Anesthesia.
Yeah, anesthesia.
Yeah.
Child dental surgery, I think, right? Like
Yes.
children is considered mild enough for children.
That's right.
Yeah.
That's right.
And why is it effective for a child dental surgery? Why would you,
Well,
what are the benefits of it as an anesthetic?
yeah, it induces this sort of relaxed, disassociated kind of feeling.
Right.
And just people will say they feel floaty or, they're kind of like there, but nothing's really troubling them too much. And
this is in a conscious waking state.
That's right.
Too, right? So I guess there's some surgeries where people need to be awake as well.
That's
And
right.
I imagine ketamine would, I suppose, be helpful. Brain surgeries like that, right?
That's right. They use it in certain types of surgery like that.
Have you ever been in the room for brain surgeries? Training on them?
Yeah. I've been in the neuro suite back in training. It's a crazy thing to see,
Yeah.
the burr hole and there's the brain sitting there. And they're stimulating different parts of the brain. They're getting
movements.
Yes. The context that I saw that was surgery for intractable epilepsy.
Right.
And so they're mapping out where they're going to cut.
That's what I talked with Dr. Rosenthal about a couple of weeks ago, because we talked to, it's so interesting. Epilepsy is an interesting thing because there's that connection. I think it was David Baer that is interested in the study, the intersection of epilepsy and psychiatry. I mean, it was very surprising when I learned that one of the main classes of drugs you would use for bipolar disorder would be anticonvulsants.
That's right.
What the hell is the connection? And nobody knows. But and then there's this ketogenic diet that comes in that's definitely anticonvulsant, and that may have applications. But temporal lobe epilepsy, really fascinating thing. And we talked about the split brain phenomenon, which is the people who've had like a radical cholecystectomy that they sever the left and right parts of the brain. And that's it's just a fascinating thing. Do you have patients that were like have a co-occurring epilepsy with psychiatric disorders?
Very, very commonly.
Yeah.
That flows both directions.
Really?
So if you have epilepsy, you're way more likely to have some variety of psychiatric challenge. And likewise, if you are someone who's affected by depression, anxiety, ADD, whatever, both directly and indirectly, a lot of the ADD crowd have abnormal EEGs because of trauma. They are more likely to do impulsive things and take a blow to the head.
Okay.
And so,
because of head trauma, brain trauma. Yeah.
Brain trauma.
Right.
Like physical.
Can you see that on an EEG? It's just there's a specific area where activity would be low or abnormal.
Yeah. Like slowing in that part of the brain or certain patterns of connectivity disturbance that are known. There's a Department of Defense database that actually compares the patient that you submit a sample of Craig's brainwave, and it compares it to the database and says, how closely does it approximate those things?
So, earlier we were talking about, I mentioned HIPAA.
Yes.
Right? HIPAA balkanizes your information. So there's no way to map. This is one advantage I think China has over the United States because there's no privacy there. They definitely don't have HIPAA. That's hysterical.
Right.
But, they can study the whole population, with their quantum computing and things like that, big data. And I assume that the reason you're going to the Department of Defense, they have a lot of head trauma, but they're also probably not subject to HIPAA. Like they can anonymize and aggregate their data without needing individual sign off. Because it's by joining the military, you probably sign away your privacy rights in medicine or to get your benefits from the VA.
Yeah, that's interesting. Like I hadn't thought about that, but I'm sure that's true. And I mean, I know like you can buy into using that or not.
Right.
You don't have to use it.
Some MBA probably from Vanderbilt got them to license that data out, which is good business. But I think that's a challenge.